Like I said, our deputies are responding 10 times a day to people in critical situations, people who are attempting suicide, who are walking out of traffic, who are bringing harm to others. And I think the county does a really good job and has effective mental health, homeless, and substance use programs for people who live in the county, as well as for people who live in the 4 cities who want help. And there's a big difference there for people who want help and people who don't. And so there's a lot of services available for those who want help, but we've identified a gap for people who act out in a threatening manner. Their behavior is so far outside of the social norms that it can't be tolerated. We recently did a survey with the Santa Cruz Downtown Business Owners Association, and we asked them a series of questions. And one of the questions is has any time in the last 12 months has your business been closed down due to somebody acting in a violent manner? And almost 50% of the business owners said that they've had to close their business 1 to 3 times in the last 12 months because of that. And so, and this group they're very challenging in that they refuse treatment. We offer them treatment, they refuse treatment, and they have repeated encounters with law enforcement and the courts. And their behavior escalates. They might get brought in the first few times on a very minor charge, but their behavior eventually escalates, and there's no intervention for these folks because of the low-level crimes that they're committing until they actually go out and harm somebody. So I'm here to say that I'm willing to utilize the limited resources that I have in our jails and with our staff to get these people the help that they need. But I'm going to need additional money. I'm going to need additional funding to get this done, and not just law enforcement, but we need clinicians out there working with law enforcement, both on the substance use disorder side and the mental illness side. But I think there's a way of putting a team together with deputy sheriffs, with mental health clinicians, who can work in the 4 cities, work in the unincorporated area of the county, receive referrals from local law enforcement, receive referrals from local clinicians, as well as community members, and do early intervention and case management for people whose behavior is escalating and may become violent. And improving the safety in our community and for our community and our visitors, and allowing them to enjoy our shopping and our restaurants and our open spaces, parks and beaches without fear has to be a priority.